Again, we're very happy to be partnering with the Howard County Autism Society tonight to bring you information about the Maryland Autism Waiver, a topic of great interest and importance to families in both Howard County and Montgomery County. Welcome, everyone. Melissa?
Thank you, Sue. And for those of you who are our friends from Montgomery County joining us tonight, the Howard County Autism Society serves Howard County and the surrounding areas, including Montgomery County and the other counties adjacent to us, providing resources and services. We do webinars, support groups, and we welcome anyone, whether you're in Howard County or not, to join us for our programs and activities and support. So just a little bit of background before we begin. And again, just a reminder, please keep your cameras off and remain on mute. We are recording this session and we'll post it afterwards and share any relevant materials. In June of 2022, Governor Hogan signed SB 636, which was legislation designed to help decrease wait times for Maryland's Autism Waiver and other waiver programs. The plan for this End the Wait Act is to cut the wait list for the state's autism waiver in half by 2024. And as most of you know, the program serves approximately 1,300 of Maryland's children with intensive services through the age of 21. There are over 6,000 children on the waiting list with waiting times that can last for 8 to 9 years. So tonight our panelists will give us an update on where we are on the waiver, the plans to reduce that waiting list, what that means for children and families, but also some general background on what the autism waiver is and how it functions, how it assists, what services it provides. I'm very, very pleased to welcome tonight Sherri Weisman, who's with the Coordinating Center. She's the Autism Waiver Service Coordinator for Howard and Harford County, and also her counterpart, Daniel Hammond, who's the Autism Waiver Coordinator for the Montgomery County Public Schools. So thank you both for being here.
Thank you for having us. As Melissa shared, we were hoping to have a lot of helpful information about End the Wait, but we continue to wait for updates. We did ask MSDE if there was anything that we could share with families this evening, and they didn't provide us with anything. So, we can do our best to share what we know, what we've advocated for, and also review some overall questions that we know both Daniel and I have gotten quite a bit over the years.
Just in case I'm asking.
And if there are additional questions, Daniel and I are happy to try and answer those either this evening or at a later date, but hopefully we'll answer everyone's pressing questions this evening. So Daniel, if you want to start.
Sure, I'd be happy to. Were we going to bring up the presentation or are we just going to go from here? Either one's fine. Unmute, Sherri.
We can certainly bring up the presentation. It may need to be tweaked before handed out, but
that's okay.
Let me see.
So I'll start with the End the Wait Act. And as was mentioned before, I'm Daniel Hammond, the Autism Waiver Coordinator for Montgomery County. Been with the waiver for a very long time, used to be a direct technician for families and a provider, and now a service coordinator. I've really enjoyed this program. It's really been most of my entire career. So in regards to the End the Wait Act, as was mentioned, the Senate Bill 636 did require that the autism waiver program the wait time was reduced by 50%. So right now we are enrolling students that have been about 8.5 years on our registry list. The registry list is always kind of a first come, first serve program. So the time that you call the registry and place your child on the list, that is date and time stamped, and then as soon as a slot becomes available for service, that person then begins the application process. The purpose of the End the Wait Act is to reduce that waiting time from about 8.5 years down to 4 years, or to cut it by 50%. Right now, we are serving about 60, or there are about 6,500 students on the wait list waiting for services, and we are serving around 1,400 to 1,450, depending on what the enrollment is. As Sherri mentioned, we haven't been given more firm information on what that rollout plan is. We were informed by the Maryland State Department of Education that it was proposed to increase the waiver program from currently serving around 1,400 to increasing it another 1,350 slots. So about 2,750 slots, so almost doubling the waiver capacity. However, that was proposed by the Maryland State Department of Education after each local jurisdiction looked at their registry list and said, these are the students that are meeting some of the technical eligibility requirements, which we'll review in a little bit in regards to enrolling a participant. And they said, these are probably the students that we can bring on around 1,350. But that was just an estimation and a proposal. The Maryland Department of Health was supposed to have a plan of how they were going to implement the End the Wait Act by January 1st, 2023, but we have not heard what that is yet. As Sherri mentioned, we have contacted the Maryland Department of Health and the Maryland State Department of Education, both of whom oversee the waiver program for updates, but they were unable to do so at this time. So that is kind of, in a nutshell, the information that we do know about the End the Wait Act in terms of increasing waiver capacity. We are waiting to hear from them, and hopefully we will hear from them soon, as we are all anxious to see how that's going to be rolling out, hopefully this July, which would be the fiscal year 24, so 2023 July.
And so we thought it might be helpful to go into what you can do for those who are currently waiting, what you can do while you wait. And one of the key pieces that's going to be crucial is updating the registry. So if you have moved, if your phone number has changed, if your email address has changed, please call the registry and make sure that they have the most current address, phone numbers, and email for you. While service coordinators have become really great detectives at trying to track families down, we don't know if we're going to have that same capacity to do that if we are handed lists of 100 families to try to connect with. So the best guarantee to make sure you get an email from one of us or a phone call, if you don't call us first, is to make sure your information is updated. And I have the registry number. I have been part of a work group to work on an online registry option so that you didn't have to call. That is not yet implemented. So unfortunately, right now, the only thing that you can do at this point is to call. And the phone number is 1-866-417-3480. And when you call, you're going to want to, if you haven't already put your child's name on the registry, please do it after this call. Leave a voicemail if they have that option, or call early tomorrow morning. If you're already sitting on the registry, please, if anything has changed, please call and update that information. They're going to want your child's date of birth. They're going to want to know, I believe, last 4 digits of Social Security number. And if you can think of the best number that you may still have in a few years down the road, or the best email that you may still have, please give them that. We want to make sure everybody is updated as much as possible. And the counties, when they were asked to do a deep dive, they did update some of that information. But I can tell you there's been a lot of movement across counties. We just inherited 6 more from different counties over the course of the week. So definitely make sure that information is updated. You're also going to want to start gathering the following information. So we need a copy of current IEPs. So make sure those are kept in a easy to grab place. We will need a copy of the child's birth certificate, their social security card, their health insurance card, and any copies of assets that are in the child's name. We do not want to know what is in your bank accounts. We are going to need to know what is in your child's. The reason it is called a waiver is because it waives the parent income. So I've had a couple families who I've had to say, please delete all your bank information. We don't need it. Please just let me know what is in your child's name. And so we only need to know what is in your child's name. And if your child is not coded as autism on their IEP, it's usually on the first or second page, maybe third or fourth. It can be a primary diagnosis, secondary diagnosis. It just needs to be there. If it is not there, we are going to need an evaluation, a formal evaluation that confirms your child still meets the eligibility for an ASD diagnosis, and it cannot be older than 3 years old. So depending on when your child's name comes to the top, if your IEP does not have autism as one of the listed disabilities, we're going to be asking for a current evaluation. So make sure you have all of this information ready, because my understanding is the state is adhering to stricter timeframes. It used to be we had 6 months, 8 months, a year to get some of this information into them, not any longer. So the quicker you can get all this information into your designated service coordinator, the better.
Sure, wanted to add one thing
Sure.
about the registry number, and that is just to make families aware that you can leave a message on that number, but they will only pick up the phone from 8 a.m. to 4 p.m. Monday through Friday. So if you do want to talk to someone and make sure that they have your information correct, and I highly recommend, no matter how simple the name and information is, that you spell it out to the individual on the phone. But they will only answer the phone from 8 a.m. to 4 p.m. Monday through Friday. Again, you can leave a message, but if you want to talk to someone, that's when it needs to be happening.
Perfect. And, you know, if we learn that there is ever an online version, we will certainly let everybody know, but I know we spent a great deal of time trying to get that formulated, and it hasn't yet been pushed through, but we are certainly advocating for it so that everything is going to be spelled correctly, every number is going to be entered correctly, and we won't be a number off, so that we are going to be able to call you at the soonest we can. And then, you know, when you learn that it's finally time to apply, you want to reach out. Your letter will tell you to reach out to your local school system liaison, and your letter should have a list of all the local liaisons. Or you could just reach out to the coordinating center. If you're in Howard County, you can reach out to Daniel in Montgomery County, and we are going to get you to the folks you need. Usually, if you're in Howard County, you deal with me in the beginning, and I try to make sure everything is reviewed. And you're also going to want to complete your application as soon as possible. If you did not receive a financial application from the state, or you received one that doesn't necessarily seem to be the correct version, please let us know that. We can send you the correct copy of the application, but you're going to want to do it as soon as possible. You're going to want to make copies of all the things I referred to a little earlier about the IEP and the birth certificate and social security cards. We're going to need all that information at one time, and then we securely send it to the eligibility determination division, and then it is in their hands, at least for the financial piece. And you want to maintain contact with the service coordinator that you are working with, whether it's me or Daniel or someone on our teams. if you're having challenges obtaining documents, getting things in a timely manner, you just need to keep us updated. There are plenty of times that we have received, you know, bits and pieces of the application, and then we don't hear anything back. So it is definitely best to just keep us updated. If you need more time, we are happy to communicate that to MSDE and MDH and try to see if we can get you more time. But we don't know that information if you don't let us know. So please keep in touch with us. And if you have decided to not pursue the waiver, please let us know that too, so that we are not exhausting our energy if you are no longer interested, and we can really focus on the folks who do want to move forward. So please keep in touch with us, and we will get those documents to the state as quickly as we can.
So to add to what Sherri said about just staying in touch, as she alluded to before, the Maryland Department of Health in years past has been fairly lenient with these applications. They understand families have been waiting a very long time to apply for services, and they don't want anyone to miss that opportunity for sure. With that said, they also realize that a large number of families are waiting. So I would say within the last few rounds, maybe starting like last spring, they really held to, if we are not receiving these financial applications from the families by the date of the letter, that they were actually closing the application. What that means that if they're not receiving it, then they close the application, and the only way to get services is to reapply, which is essentially to put your name back on the beginning of the list for 8 years or potentially 4 years if they do release the End the Wait Act. And again, it's really not to scare families. They just want to make sure they're getting them in because they want to make sure they're serving as many families as possible and not holding a position open for other families that are going to use it. I've worked with every single county in this state, and all the coordinators are very good about helping the families gather the information and informing the state where they are in it. So we're certainly here to support you. But it's become more imperative in the last year or so to make sure we meet all of those deadlines. Did you want me to go into the eligibility, Sherri?
Yes, if you could.
Sure. So the eligibility for the autism waiver program is in kind of 3 different sections. The first one is financial eligibility, which practically every student is going to meet that requirement because it is based on their finances, not the family's. So assuming the child does not have more than $2,000 in his or her name, or they're not making more than $2,000 a month, it's actually slightly more than 2,000. It's right around 2,100. It's I believe triple SSI payment, Social Security income of what it can be. So as long as they don't have more than that, they're going to be financially eligible. A very common question that we get is 529 plans or the ABLE accounts. Neither of those count as an asset for the child because you can transfer it to other children. So those are fine. Also, if you have a special needs trust that is Medicaid protected, that would be fine as well. The only concern financially that we've run into is if families have, you know, a checking account or a savings account in their child's name. Normally, the Maryland Department of Health is willing to work with those families to move it into something outside of the child's name, spend it in the child's name, or to put it in something like an ABLE account, which is a great income tool to protect their assets. So that's the financial eligibility. The technical eligibility is several pieces, but the primary ones are that they're between the ages of 1 and 21 years old, assuming they maintain all the other eligibility. The waiver services would go until the very end of the school of their last year in school. So if they're getting a diploma, it would be at 18, 19, or 20. If they're getting a certificate at 21, it would be the end of June of their last year of school. They also have to have at least 15 hours of special education services on their IEP. What we look for specifically is we go to the services page of the IEP right after the goals, and we add up all those service hours and make sure that they have at least 15 hours. Some counties do this differently, and You have to go through the IEP with a little bit more of a fine-tooth comb to see if there's a one-on-one or some type of additional related service that the child is getting. But if they have at least 15 hours in their related services page on the IEP, then they would be meeting that criteria. They also need to be able to be safely maintained in their home and community. You're not enrolled in any other Medicaid waiver program. So if your child is currently enrolled in, say, the Family Supports Waiver or the Community Pathways Waiver through the Developmental Disability Administration, when it's time for them to apply for services, you would want to review each one of those waiver programs with your coordinator and see which one's going to be a better fit for them, because they can't be enrolled in both at the same time. And then once they're enrolled, it's that they're actually using services. One of the requirements is that of the services that we'll talk about in a moment, they're trying to access at least some services every single month. And that's what we call the technical eligibility. The last one is the medical eligibility. This is kind of twofold. One, that your child does have an active diagnosis of autism. As Sherri mentioned, if it's on the IEP, then the IEP team does renew that diagnosis every 3 years automatically. So that's all you need to have. If it's not on your child's IEP, then you have to have a full medical evaluation within the last 3 years to demonstrate that your child has the diagnosis of autism. I can't speak for other counties, but most of the time, if you have a full medical diagnosis, I would recommend bringing that to your IEP team for the local psychologist to review, because at the very least, if that's not your child's primary diagnosis, they can probably add it as a multiple diagnosis. Many IEP teams are willing to do that. And then once it's on your child's IEP, then you don't have to redo it every 3 years. The last piece of the medical is an evaluation by your local school team called the level of care assessment. This is a meeting that you're going to have with the school team to discuss your child's needs in various areas. The basic living skills, getting dressed, hygiene and grooming, eating, all of those needs that they have, just basic tasks for every single day. The functional living skills, communicating with others, social reciprocity, being out in the community, judgment, being aware of danger. And then the last section is maladaptive behaviors, aggression, self-injury, anxiety, perseveration, eating concerns, self-harm, a whole list of interfering behaviors that we go through. In each one of those categories, the team is looking for what level of support this individual needs to maintain their safety and access their community. And based on that child's needs, they give it, they follow a scoring criteria, and then the child has to meet the minimum scores in 2 out of those 3 areas to be eligible for the program. The reason that medical assessment is necessary is the Autism Waiver program is not designed to serve every child with autism. In fact, it got started in 2001 to take students out of institutional placements and get them in-home services. Technically, the definition of the level of care assessment is stating that without intervention, your child is either at risk for or in need of an institutional level of care. Now that's kind of in the 1970s, 80s definitions, and thankfully we have a lot of supports in the community for the students that we serve, but it's really designed to serve students with fairly severe needs that need a lot of support. So the students will need to meet that assessment criteria to be eligible for the program. All of these eligibility aspects, the financial, the technical, and medical, are reviewed every single year to make sure the child maintains their eligibility for the waiver program.
And I just noticed a question about why are these meetings held at the school? And I can answer that. MSD requires, the State Department of Ed requires a multidisciplinary team that consists of a service coordinator, a teacher, a school psychologist, a teacher if we can get them, or a case manager, a school psychologist, and the parent, and anyone else the parent wants to have attend. And when we meet, we are looking at what is going on at the home and what is going on at the school. And we try to make the most sense on that form. Is the child more behavioral at home? We're going to make those scores a little higher to reflect what's going on in the home. If behaviors are worse at school, we're going to try to reflect that in the scoring. So the reason we meet with the school team is it's required by the State Department of Education, and it's our way to try to make sure that we are capturing what parents are seeing and what the school team is seeing. And we note what school sees, what parents see, and then arrive at a score that is appropriate based on what we're hearing from both parent and school team members.
Sure, and just to add to that, you'll find when you do the assessment, a lot of the questions really are, the answers are really driven by the family only because what they're asking. For instance, what level of support does your child need bathing? The school doesn't really know that. What level of support does your child need when you go grocery shopping or take them to the movies? Or what level of interfering behaviors do they have in a crowd? So there are certain aspects like the child's ability to learn how they're communicating with their peers and things like that, that the school team is very helpful on. And to add to Sherri's point, it is a school psychologist or a licensed psychologist provided by the school team that has to certify the information. But you'll find a lot of the information from the assessment does come from the family because you certainly know them best. And that's really what the information is about. How is this child in the home and community? Just to grab a couple other questions from the chat, I think I covered it, but 529 plans and ABLE accounts are acceptable financial places to save your child's money. So if you have money in a 529 or an ABLE account, it will not affect their eligibility for the program. And for the IEP, it's 15 hours of special education per week on the IEP. So if you look at the services page, they should be getting at least 15 hours per week.
Okay. So I will review, once you get on the waiver, what you can potentially access. And we'll talk about some challenges a little down the road, but these are the dedicated services that the autism waiver has to choose from. So aside from your child qualifying for Medicaid, which can potentially assist with things like speech, OT, things outside of these specified services, ultimately, these, unlike DDA, we don't have a list that you can, a significant list that you can pick and choose from. So these are the main services, and we certainly do our best to help you get connected with providers that can help provide staff for these. But just like everyone else, we are having significant staffing challenges. And as some of my families who have worked with me for a while know, I often tell them, just be patient. We will find you somebody, hopefully sooner than later. So the big service that a lot of our families have really loved accessing and that they have found really helpful is Intensive Individual Support Services, or IISS, and it's a goal-directed service that can be provided in the home, somewhere in the community. It cannot be provided in school. And depending on the after-school program, sometimes if it's a local after-school program, there are potential liability issues. So sometimes they'll have to go through some legal channels to make sure it's okay to have your IISS worker attend. But anywhere else in the community is usually pretty okay, as long as it's within the state of Maryland. And what those goals work on is really up to you and the provider to come up with appropriate goals for your student, your child, whether they be working on life skills, working on communication, being able to go to community-based places and gradually build up their tolerance to these places. We've had students do a whole variety of things. So I tell families to think creatively, think of some places that you have struggled with taking your child, and let these folks work on helping your child get acclimated to them. We've had some students work on going to the grocery store, which requires them to potentially create a list and go to the store and pick out their items and then pay. So there's a lot of good goals being worked on. So it's really dependent on where your child's areas of needs are and what the provider feels like they can appropriately manage and try to target. They can even work on behaviors. So, definitely if you have questions about this winter on, please talk to your service coordinator, ask them, could they work on this? And your coordinator or provider will be able to tell you. But we've had students do a lot of different things, and a lot of our students have been able to become more independent with things. So it's really great to hear what progress students are making with these services. Pre-pandemic, the max hours are 25 hours per week. I won't even get into the public health emergency allowances. They were raised in order to better support families during the public health emergency, but as that is ending and our Appendix K allowances are gradually fading, I will do my best not to further confuse everyone, but just think 25 hours per week of IISS max. There's also respite care. So you need to go run an errand and you don't want to have to take any of your kids with you. The respite worker can at least keep your child on the waiver safe while you go and do what you need to do. You want a date night, you just want some time to yourself. You don't even have to leave the house. Respite is to give you a break. It also includes respite camps. So Camp Green Top, Camp Fairley Manor. A lot of our families will sometimes try the weekend respite camps to see if that's a good fit for their child. Most of our kids seem to really like it. So we've had families start out with weekend respite and then graduate to the week-long camps in the summer. Now, the pandemic and some construction issues have prevented some of the camps from operating at full capacity, but they have been operating. So as soon as we find out that winter camps and spring camps and summer camps are opening, we try to let our families know who we know are interested. There's also a service called therapeutic integration. And respite hours are about 336 hours per a fiscal calendar. So those hours go quickly depending on how quickly they're used. So we try to work with families to make sure that you are on top of your hours and all of your hours are not gone by, the third month of the fiscal year, unless that's when you truly need them. So therapeutic integration is typically a center-based program that is supposed to work on a variety of different functional tasks. So I know of one program that really focuses on vocational tasks. Other programs might work on more social-based tasks. So they do have to take data. They are required to have treatment plans for therapeutic integration and IISS because there are goals required. And my first thing I tell parents is go look at the available options, see which ones feel like they would be a good fit. Because it's solely students on the waiver, we recognize that some of our students don't do well being around other students with significant behaviors. Sometimes behaviors set off some of our other students. So you're going to know what looks the best for your child. So all these programs are so different in what they offer and the type of students that they are serving. So the best thing we typically recommend is go see what the options are and, let us know what you're interested in. And if your child needs one-to-one support, either because of behaviors or attentional issues, there is a more intensive option. So with regular therapeutic integration, you can access up to 20 hours per week. With intensive therapeutic integration, it's going to be 15 hours per week. And it's ultimately which is going to be needed to keep your child safe. There's environmental accessibility adaptations. So anything done to the home to make it safer. And my families will tell you, my usual sentence with them is, if I can explain this in 1 to 2 sentences, I can usually get it easily approved. The more detail I have to use to explain exactly how this is an environmental accessibility adaptation to make the home safer, MSD will definitely push back and ask, is this truly a safety issue, or are we just trying to get other things covered? So things that we have covered are and have included fencing. It's probably not going to cover a whole fence. It's $2,104, so $2,104 is the max to use over the course of 3 years. So $2,104 is probably not giving you a whole fence, but it can be used at least towards part of a fence. We have installed gym padding on walls for students who need that crashing into something soft to regulate. We have installed cameras inside to make sure that kids, when they are in their rooms or in certain places of the home, are staying safe without having to have an adult on top of them at all times. So again, it is definitely dependent on what your child's safety needs are. Those safety issues absolutely need to be documented in the form that Daniel reviewed about the level of care form, because that is documentation that certainly helps if we are trying to get money toward the fencing. If your student, your child doesn't have elopement on their level of care form, it's going to be a little bit of a harder sell unless it's a fairly new behavior. So it really should, whatever those funds are being used for, really should address the challenges that the safety challenges that you're facing. There's family consultation. This is more a service for parents. So you need some support with behaviors, or you need some guidance with communication. A family consultant can help with all of those. The key to remember with this is you want to make sure that when you are contacting providers, you let them know what your needs are, because a family consultant can be a social worker, a special educator, a speech therapist, an OT. You want to make sure that the person being sent to your home knows exactly how best to give you guidance. So that's a key thing for that. And then adult life planning. This is a fairly newer service that MSDE added to the waiver when they started hearing that families were not hearing from their developmental disabilities administration coordinators, or they were having frequent turnover of a DDA case manager. So the purpose of an adult life planner is to get you to start thinking about life after school. So they, along with us, will help you prepare. What types of things should you be doing at 18? What types of things should you be thinking about between 18 and 21? And between the two of us, we can certainly make sure that you're filling out paperwork that is going to best help your child, young adult, once they transition out of the autism waiver and most likely into a developmental disabilities administration waiver, and just important things to know, like powers of attorney and guardianship. These are things that a lot of our families don't always think about, but we are certainly there along with adult life planners to help get you in that mindset. Some adult life planners have also helped our families tremendously when trying to determine which DDA waiver they want to choose for transition or what DDA programs they might want to consider. We've had some adult life planners accompany families on DDA tours. So they have been really helpful to a lot of our families prepare for that life after the school bus.
Sherri, is it okay if I would pop in with some questions that are in the chat?
Absolutely.
All right, good. So we did have a question, and I think there may have been some confusion a little bit, and you cleared that up, that the autism waiver covers, a student until the age of 21.
Correct.
I did put a link in there to DDA so that you could, if you have a child or if you were on, trying to find some information for yourself about some other waiver programs available under the DDA umbrella. So if you could take a look at that. But one question is for the child that is, quote, high functioning, yet clearly lacks skills necessary to live independently in all aspects. What happens to those children that are sort of in the gray area? So who maybe wouldn't qualify for something like this, as they are usually overlooked?
Sure. I can take that one, Sherri, if you want me to.
Sure.
So kind of two answers to that question. One, in terms of higher functioning, but clearly lacks the skills necessary to live independently. That's one thing that we really advise families when they're going through some of these initial assessments, is to really think about your child's needs. And it can be very hard to do. As parents, we really try and support our children as much as we possibly can. And it's difficult sometimes to be aware of all of the things that we are doing to help support them. So to give you an example, just this week we were enrolling a family and we'd ask the question, how does your child do with toothbrushing? And they say, oh, it's fine, it's no problem. And what that really means is the child is no longer biting them while trying to brush teeth, and that's a success, and it is a success, and it's great. But they're forgetting the fact that they have a modified bathroom, they have a checklist for the child to follow, and if they're not in that bathroom and it's not done at 8 o'clock after they've already done these 3 other things, that routine is a disaster. So they have created a successful environment for the child. But when you're communicating what the child's needs are, we have to think about what they need with taking some of the supports that we have put in place out of the question, so that we can kind of get a real baseline of the support that they need, because that's a discussion about the supports that they're going to need through the Autism Waiver program. So for the students that are not meeting the eligibility criteria, but they are still in need of some services, my team typically turns them over to local resources, either like the ARC of Montgomery County. We also, for our service coordination team, work with the local Health and Human Services, which do have not robust programs like the waiver, but they do have funding for small programs like camps or intermittent therapeutic programs, or things of that nature to kind of fill those gaps. So that's really what's available. There's also the Family Supports Waiver through the Developmental Disability Administration, but they're typically looking for the same things that we are in the Autism Waiver. So it's really more local supports at that point. But I just wanted to reemphasize, if you are of the opinion that your child really couldn't live independently, and say they're older, they're 16, 17, 18, which unfortunately is some of the students that we're getting to, given the waiting time. When you're doing the assessments, you really do have to focus on what their needs are at that time and make it really clear to the assessment team.
And it's really important. I know we try to send the form out once, if not twice, well in advance of the actual meeting, because we know that it is really hard to think about every single little thing that you've done to make life work. So we send you a list of all the types of things that we're looking at for each of the categories. So for instance, there was actually a work group that took the whole form and spelled out exactly what things we're looking at. So I've sat in many meetings. I've been doing this for 20 years. I've sat in many meetings and parents have said, oh, my child's completely independent with eating. Oh, so they use a napkin. Oh, no. So they sit for the entire meal. No, they use a fork appropriately. Well, that they do. So they can make a meal on their own. No, they can't. So it is the definition list for each of these sections is very detailed. And sometimes just seeing all the things that we're looking at helps parents think, oh, wait, I do make a lot of accommodations for my son or daughter. So we want to make sure that you are capturing those, because we don't know your kid when we do this initial assessment. The benefit of reassessments is that we've had a year to get into the school, to get into your home, to see your child a little easier. But when we sit down initially, it is a very rare occasion when I know the kid that we are talking about. So we are incredibly reliant on feedback from the school team and the parents. So when we tell you, really take this form and think about it, and as you're going through the day, pull it out and jot down notes, because we guarantee there are things that you've done to make life easier that you don't even think about, or that you're doing and you're not even thinking about it because you've been doing it for so long. It's now just part of your daily routine. So if and when you get this form, please, please, please review it. Make sure, don't fake good, because we've had that happen and kids have not qualified. Please be as open and honest as you can. There is nothing that our teams have not heard before. Everyone on my team has come from a special education program, so we've either dealt with it personally, or I've been in this job for a very long time, so I've heard pretty much everything. You're not going to shock us by being as brutally honest as you can.
There was another basic question about a child attending a private school. Right now, through the Autism Waiver program, your child does have to be publicly funded. So if the IEP team has met and determined that the local school system could not meet their needs, and say, for instance, Howard or Montgomery is paying for a private placement like Kennedy Krieger, Ivy Mount, or a school like that, then they are meeting the eligibility requirements because it is publicly funded. If the parent has taken them out of the public school setting to place them in private school or homeschool, right now they're not meeting the eligibility requirements. There have certainly been advocates in that area. I'm one of them. That shouldn't be a requirement, but that is the current COMAR regulations, that they're in a publicly funded school setting.
So that also includes no homeschooling. So if your child is currently being homeschooled, that is not technically eligible for the waiver. It's been allowed during the public health emergency because we have not been able to disenroll anybody. So if you know a student who's currently being homeschooled and they're on the waiver, or they're in a private placement, or they're in a different type of program, once we officially lose our Appendix K allowances, which right now is aiming for October 11th, 2023, those students will need to be disenrolled. And we are trying to work with those families now to make sure that they are prepared for what is going to come next for them. So That is key. Your child has to be in a school program
And-
that's funded.
Sorry, Sherri, we had a question in there too, that the assessments need to be done in a school setting, correct? Versus by a medical provider. Can you just talk about that just a bit?
Correct. So the form that we complete is done at the local. Well, so if they attend a public school, in our county, in Howard County and Harford counties, we will typically meet with the parent and the school psychologist if they're available. Although if the school psychologist doesn't know the student, we'll meet with the parent and then seek feedback from the school team if no one can attend. At the public school, we're meeting with the school team members. And it's only because the State Department of Education has it that these are the members of the team to determine the level, to determine the scores on the level of care form. So this has been the requirement since day one of the waiver.
Mhm. So to give a little bit of background about that, the Autism Waiver Program is called a 1915C waiver, and it was actually kind of the Maryland State Department of Education that started it. But it is a Medicaid waiver. That's what funds it. So it also has to go through the Maryland Department of Health. The quick history is the Maryland Department of Health said, sure, we can do this waiver, MSDE, if you want to oversee it. So the Maryland State Department of Education learned that through the Bridge to Excellence funding, they could offer this service with the service coordination through the local school systems, as well as getting the assessments done through the local school systems. So that's why the local school psychologist needs to attend the meeting. They are the licensed professionals with the kind of the background and the education to say, yes, I'm signing off that this individual is meeting the level of care. And then it's the local school systems that is providing the service coordination. And in Howard County, the local school team contracts out with the coordinating center. And I oversee it in Montgomery County, but we also contract out the service coordination directly to the Health and Human Services Department of Montgomery County. So if that kind of helps you see why the school teams are involved, it's because that's how the regulations came down to actually fund and organize the program.
That's great, thank you. We did have a follow-up question to one that you answered, Daniel.
About adult supports for children that are not quite or about to age out.
Yep, that's it. A child who's about to age out after being on the waiting list for years, and what community supports. If you could
So-
answer that.
Sure. If a child is about to age out, if they're around 19, 20, or 21, we strongly recommend that you apply for Developmental Disability Administration services. I believe Ms. Rosenberg was kind enough to put the link to their website just a little bit above that comment. So once you apply for their services, they will assign a local coordinator to help you finish the application and go through what services they may be available to provide. Now, the Developmental Disability Administration also has a waiting list, but it is very different from ours. Ours is a first come, first serve waiting list. So again, date and time stamped, and when a slot becomes available, we move to the next one. The Developmental Disability Administration has something called the Transitioning Youth Fund. And that means there's a special window of time that someone can be approved for services. And it is right around their 21st birthday when they're leaving school. So if they're no longer eligible for waiver services like ours, June 30th, starting July 1st of their 21st year, so their last year in school eligibility, that is when their services could begin. So say they turn 21 in April, they graduate that June, Developmental Disability Administration services could start July 1st of that year. And it's really imperative you can apply for those services at any point in your child's life, when they're 2, 3, 17, 18. But that transitioning youth fund is for around when they're 21. So right when they're at that point is when they would get funding for adult services.
and kind of along those lines, for students who age out or graduate before 21,
Mhm.
it's very unlikely that DDA steps in to fund adult services until your child turns 21. So that's where the family supports waiver comes in. And we have had students, not many, but a few who have graduated with a diploma early or than 21. And we help them transition into the family supports waiver so that they have something to support them while they work on what comes next, because not every student with a diploma is appropriate for a college of some sort. So that's some type of help, but it's better than having nothing. So we definitely try to work with families to make sure that whenever you're leaving, you have something to catch you when you leave us.
Thanks, Sherri. Another question here that, are you eligible if you have private health care insurance? And if so, does your child get Medicaid once on the waiver?
Yes, you are able to have private health insurance, and everyone who qualifies for the autism waiver has to qualify for Medicaid, which is why we ask the questions about, does your child have more than 2,000 and some in their name? And it's your child has to be able to qualify for Medicaid on their own. So we waive parent income, and as long as your child meets the financial piece, then they can that's part of the reasons they can help qualify for Medicaid. But how that plays in with private health insurance is your private health insurance is going to be the child's primary insurance, and Medicaid will always be the payer of last resort. So there's a much lengthier discussion about how they work together, but essentially, if you see a provider that accepts your private health insurance and they also accept Medicaid or a managed care organization, then the Medicaid can help cover some of those copays or remaining balances. But yes, you can absolutely, and most of the students who come onto the waiver absolutely have private health insurance, but they also have to be able to qualify for Medicaid because that is what pays for all the autism waiver services.
Thank you. That's great.
Sure.
And I know that sometimes people you have a child who's on the waiting list for the autism waiver, and then they also apply while they're waiting for a different kind of a waiver service. Are you able to have both?
No. So you cannot have two waivers. You can have REM. So I know we have a few students who are in the rare and expensive case management program, otherwise known as REM, and they also have the autism waiver. Now, we do have one family who's in REM, receives CFC funding, community first choice funding, DDA case management leading up to their transition and autism waiver. So you can receive funding from other sources, you just cannot be enrolled in two waivers simultaneously. So if there's another program that is not a Medicaid waiver, you can potentially be in the autism waiver with that other program, as long as it's not called a waiver of some sort. So if you are enrolled in a DDA waiver, which happens, by the time we get to families, there are kids who are already in a DDA waiver, we're going to ask you, what do you want to do? And that decision is entirely up to the parent. We can certainly help walk through that decision making, but we can't make that decision. It has to come from the parent.
Thank you. And Sherelle, I think you had your hand raised. Did you want to?
Yes, thank you so much. My question is, what if the school doesn't agree with the diagnosis my child had an external evaluation and then an evaluation with the school, and I'm a little bit unsure if I remember the psychologist saying that she didn't think my daughter was on the spectrum, but because she has more than one diagnosis, if that is not on her IEP, but I have an external entity that gave her an evaluation and said that she is on the spectrum, how do I approach that with the school or ask them to put that on her IEP? Thank you.
So for any student that does not have autism on their diagnosis, an external evaluation is absolutely fine. It just needs to be current. So we've had a few occasions over the years where the school psychologist did not agree with the autism diagnosis. If we have an external evaluation, we honor that. We are required to honor that. So just make sure you are keeping current. So we are going to need, when your daughter comes to the top of the list, or for anyone else this may be applicable to, when your child comes to the top of the list, we are going to need an evaluation that clearly documents that your child still meets the diagnostic criteria for autism, the ASD diagnosis. If you do not have a current one within the past 3 years of the date your child's name comes to the top, you're going to need to get one very quickly, because at that point, we don't know how much flexibility we're going to have. We certainly try to advocate for families to have some extra time, but my suggestion to anyone who fits that situation, just keep up with the external evaluations. Make sure you have something current every so often so that you can give us something to confirm that diagnosis, because we are absolutely going to need something. It does not have to come from the school.
To add to that too, MSD has been quite clear that a letter from your doctor is not acceptable. It cannot just be doctor saying, I have this patient and I'm confirming the diagnosis of autism. They do have to perform some type of evaluation, like an updated ADOS or some type of rating scale. They have to have the date of the evaluation, the psychological tool that they have used to measure, to demonstrate that the child has autism, and that has to be within the last 3 years.
Thanks, Daniel. Another question, is there any way to roughly estimate when your child's name might come up on the waiting list? Currently, you're probably processing applications from 2015, is that?
2015, late 2015. It is about eight and a half years right now. In Montgomery County, families typically contact me and we can look at the list. Sometimes that the state does give us an updated list, but I only have access to my county. The registry can also tell you, but again, you typically have to call them between 8 and 4 to get that update.
And the registry stopped telling parents how much longer they had or what number they are. So if you call the registry and ask, can you tell me where I am? They are only going to give you the date, the timestamp information, and they could also confirm what information they have for you. So if you're calling the registry to ask where you are, that's a great time to make sure your information is current. But as Daniel said, the local jurisdictions, for instance, I have a copy of the registry from, I think, December of 22 is the last updated version I have. So at best, I can look to see, make sure you're on our list. If you're not on our list, I'm going to ask you, have you moved in the past 8 years, and what county were you on 8 years ago? Because we are finding sometimes parents are on a different county's list, but I have, we all communicate with each other, so it's fairly easy for us to see if you're on another county's list, but if you lived in Howard County or if you lived in Montgomery County or any county for your entire past 8 years, then we need to look into what list you put your child's name on, because we have had a couple of occasions where the parent thought they were putting their child on our registry list, and it turned out that it was actually the DDA registry or wait list. So, we absolutely do our best to try and make sure you're on the list. So if you call Daniel or I or email us and say, can you tell me where I am on the list? What we're going to be able to tell you is the date and time you put your child's name on the list. We're going to be able to tell you the approximate time frame of what we are currently processing. And so you'll get a slight idea of where you are and how long it will take, but the wait is definitely going to impact significantly people's wait time. So we're definitely, right now it's about 8 to 8.5 years, but it's going to look very different. And, the way that the registry is may have to change a little if we move to a waitlist system, because right now, when you put your child's name on the registry, you don't need to prove that your child is eligible. Whereas when you go onto a wait list, that is when you are having to prove your child meets that program's eligibility requirements. So we're hoping that that information gets explained to us once we know what's happening with the wait. But we can certainly try to get that information to you all and the different agencies. I'm sure there will be agencies making sure that information is dispersed to everybody, but we're kind of anxiously waiting to see what's going to happen.
Absolutely. It was mentioned that decisions are up to the parents. So if a child is turning 18, who makes the decision if there's no guardianship or something legal for parents to have decision-making power?
So
Go ahead,
go ahead,
Daniel.
Sherri. I was going to say that is a question we have brought up many, many times, and we certainly encourage families to look at the different options when their child is 18, both power of attorney, guardianship, all of those. However, there has not been a case for instance, like a plan of care or a level of care assessment or any of the consent forms that MSD has not accepted. What I mean is that after a child turns 18, in our waiver program, at least, it is still the family making the decisions. We haven't run into any roadblocks there. I will say in other realms, though, like doctor's appointments and things like that, you may need to have that done immediately. We have heard of cases where parents try to set up their 18-year-old's doctor's appointment and they're told, no, I'm sorry, you have to have your child make this appointment or show us guardianship. So we have not run into any interference from the Maryland Department of Health or Maryland State Department of Education with families continuing to make those choices for their children.
Thank you. Another question. My child met all the criteria to qualify for DDA services, except their adaptive scores were high. With that being said, if time's running out for the autism waiver services and the child does not qualify for DDA services, what's the alternative? Especially since all data show they lack the skills to live independently.
That's a tough one without knowing your child. You certainly can appeal DDA's decision. And Daniel, you may have some thoughts, but that is a really tough one because I don't know
Right.
if I've ever had a kid not qualify for DDA. And we've even had kids, well, young adults, who presented higher than what you might think and they qualify for DDA. So I'm not sure.
We have had some students not qualify for DDA. They're normally looking at like Department of Rehabilitative Services for like vocational placements and job training in terms of after 18. It is very rare that we have a participant that's not meeting DDA, only because it's a little bit different, but they're using almost the exact same assessments that we are. So there are other resources like the Department of Rehabilitative Services and other vocational programs. But again, that would probably more be a longer personal conversation to kind of work out that individual need.
And the other thing is, so I know I have had students whose matrix score was determined by people who did not know the young adult. And so they interviewed, for instance, people who were fairly unfamiliar. They'd only known my client for about a year. They neglected to email or reach out to me. I knew the student for about 15 years. They didn't ask the parents. They didn't ask anyone who really had good information. So my other suggestion would be, if they did not involve the right people to determine your child's scores, you may want to revisit and ask for a redo if that's possible. I know in this individual's case, they were able to revise the matrix score because the parent appealed and asked that people who knew this young adult much longer be interviewed, and their scores did change dramatically when they interviewed people who knew them. So that may be another route depending on whose perspectives were taken into account. Hopefully that helps.
Thank you. So if you apply for the waiver and your child is denied, I guess the question is more about the appeal process. How would that work? How would you appeal that decision?
So once a child is determined ineligible, obviously they're notified of what the reason is, either it's financial, technical, or medical. Then we still submit the application, because that is what you need to have to appeal. You need an official denial from the Maryland Department of Health. So you go through the process and submit the application, and then just like they would send you an approval letter, they send you a denial letter with all the information to appeal and who to contact. And you write that letter of appeal saying, I'm appealing this decision, and then they set up a hearing date. Depending on what the eligibility criteria is, you're going to have to prove why your child is eligible. So for instance, if it was like a technical eligibility where your child wasn't enrolled in school, but you were in the process somehow, but they missed the deadline and now your child is enrolled in school, that may be overturned. If it was in regards to one of the assessments, you would have to demonstrate why that assessment was not capturing all the information to have the child supports. But all that information would be mailed to you about how to appeal.
And you want to pay attention to the deadlines, because if you miss a deadline, you will miss your opportunity to appeal. So definitely read that letter that they send you carefully.
Thanks, Sherri. There was one other one. Oh, a follow-up to the question about the child turning 18. What if the adult child and parent disagree on services? So this is what I meant in terms of who decides.
So that would certainly depend. Obviously, if the child is under 18, you're still their legal guardian. It is somewhat rare that we have a participant able to completely advocate for their own services in terms of what they want. I have had several students talk about what they want, for example, and they want their direct technician to come over and take them out to soccer. And they really want to do that activity. And certainly for the participants, we encourage their independence as much as possible. If we do have a participant that is coming to the meetings and saying, I don't want this service, I want this one, and I want this hour, that's a lot of strong self-advocacy skills for sure in terms of their functional assessment. So it's a good thing, but that honestly would have to be posed to MSDE. Ultimately, if the child is capable of making their own decisions, it does start to question the eligibility if they're advocating that much. But yeah, that type of question would go to MSDE in terms of who decides.
I will say I've had that situation happen once where the student was canceling his IISS workers from coming, and we ended up disenrolling. But I've only had it happen once. I've had kids who were not maybe thrilled with their IISS workers coming, but none that were calling them on the phone and canceling. So I would say it's definitely a discussion to have with your young adult, because this program should never be a negative for a child. So if it is turning into a negative program, it's not going to be super helpful. And there may be some other programs out there that might be a little more appropriate for a higher self-advocate, but yeah, that's a tough one.
We probably have time for maybe one more question. I do want to mention, I apologize, we had a glitch on the Spanish interpretation. We will be sharing the recording. Following it, we will add in the Spanish interpretation to share separately after probably about a week or so. So if there were any other questions that anybody had, they wanted to put into the chat, or Sherri and Daniel, any closing thoughts, anything you feel we didn't get to that you wanted to share? Or Sue from X-Minds?
One real quick thing I saw on the chat is how long is the DDA waiting list? Again, it's a little different from ours. They're more like an as-need program. Also, to clarify, the Autism Waiver Program, once a child is eligible, they're eligible for all of the services to the maximum amount. We don't have to necessarily justify an increase in service. We try to provide as much as possible. On the other side, DDA, you're eligible, and then you need to prove everything that you need. So you kind of build a budget and you build a case for what your child needs. And there, in terms of what you're getting, you really have to advocate for every aspect of your child's care. Whereas the autism waiver, it's okay, this is what we provide. Now what's going to work for your child?
Okay, I think we caught all the questions, and I want to thank Sherri and Daniel for joining us this evening. It's been a great presentation. We will be sharing the recording. Again, I apologize for the glitch on the interpretation, but we will be sharing a recording with Spanish interpretation and some other supporting information. I see lots of thanks in the chat here for a very informative presentation. And will there be another forum? Hopefully we can be able to add some updates and share that with everybody very soon. So thank you. And thank you to our friends at X-Minds for joining us, and Sue and her team. And we're really glad to be able to partner in this way to share information with our community. So thank you all so much and have a wonderful evening.